Good Friday afternoon. I'm Dr. Martha Buchanan, Senior Director and Health Officer here at Knox County Health Department. Our moment of gratitude today is dedicated to our Women, Infants, and Children program, or WIC program, who creatively found a way to celebrate and raise awareness for World Breastfeeding Week while making sure our team and the folks participating in the event were safe. They held the event for moms and children in a drive-through format while stressing the importance and numerous health benefits associated with breastfeeding. We appreciate their efforts to hold this incredibly important event in a safe and thoughtful way. One of my lights just went out, and I don't know if we need to address that or not. I'll keep going. In the same vein of finding creative ways to celebrate, today, our real world example of how to put the 5 core actions into play is a wedding shower.
All right, we're gonna brighten this light just a little bit. So
Oh.
make it a little brighter.
Okay, getting married is an exciting time, and we want you to celebrate with your loved ones. The good news is there are ways to celebrate safely. We have seen many people conduct drive-through bridal showers. That's a great idea and lets you see your friends and family without risk of potential transmission. Virtual bridal showers are also a great idea. You can send the gift to the couple prior to the event and just celebrate later virtually. If you want to do something in person, that's fine as well. Just make sure you keep the group small. If weather cooperates, outside is preferable, but indoors works too, as long as people are spaced out and wearing masks. If you can't space them out. I mean, you could have a box of masks at the front door for people, so the precedent is set when they get to your home or get to the event, they know they need to wear a mask. And that physical distancing is important. Remember, risk is based on the number of people you're around, how close you are, and for how long. If you keep that in mind, you will be more likely to ensure your event is safe for both you and your guests. The Board of Health meets next Wednesday, August 12th. It's Friday, via Zoom at 5 p.m. The public may watch the meeting live on Knox County's YouTube channel or the Knox County website. It may also be viewed on community television. Today, we are continuing to test at the Jacob Building in Shell Highway Park from 9 a.m. to 3 p.m. We will continue to test until 3 p.m., but may have to cut the line off earlier than that so that we can get everybody through, get everything processed into the lab in a timely manner. We continue to expect long lines, so we encourage people waiting to please be patient with our teams as they work quickly and efficiently as possible. As a reminder, this upcoming Monday, August 10th, we will not be testing at the Jacob Building due to a prior reservation at that space. As a reminder, another reminder, we have a link on our website that shows other testing options in our community. Now we'll move to the local situation. We have 129 new confirmed cases since yesterday, giving us 4,500 confirmed cases, that's a round number, of COVID-19 since March. Additionally, we have 142 probable cases. 2,418 of our cases have recovered, giving us 2,182 active cases. 211 individuals have been hospitalized at some point in their illness. Currently, there are only 16 Knox County residents hospitalized for COVID-19. We are grateful to report no additional deaths related to COVID-19, keeping our total at 42. Now I want to spend a few minutes talking about contact tracing. For some background, the Knox County Health Department receives notification of illnesses of public health concern year-round, not just COVID-19. There are more than 60 reportable diseases in Tennessee, and we actually do contact tracing and investigations on a lot of those. That said, if someone tests positive for COVID-19, that positive test result is shared with public health, either with us or with the Tennessee Department of Health. Once the Knox County Health Department receives the notification of the positive case, a member of our contact tracing team initiates an investigation. The goal is to do so within 24 hours of notification. Contact is not always made on the first attempt, so sometimes it takes a little longer. When public health is able to speak with the case, we ask them a series of questions based on state and federal guidelines and what we know about COVID-19. This includes where he or she has been, who he or she's been in close contact with recently. The positive case provides the names of his or her close contacts to public health. Then KCHD's goal is for us to initiate contact tracing with those individuals within 48 hours of notification of the positive case. Once again, contact is not always made on the first attempt. It's important to remember that close contact is defined to being within 6 feet of another individual who is an active case and for more than 10 minutes. And also during their period of infectivity. That's an important piece that a lot of people aren't aware of. Just because you believe you're around someone who has COVID-19 doesn't mean that you're around them during the infectivity period or were around them for enough time or close enough to be classified as a close contact. There's a lot of nuance that goes into determining if someone is a close contact. Our staff members are trained to ask questions that lead to accurate and complete information. Additionally, contact tracing is well documented an effective process to reduce infectious diseases in the community. That said, the information we can act on is only as good as the information that is provided to us. So if someone does not tell us they're close contacts, we are not able to reach out to them. So if we call you, it takes a while, but give us the information we're asking for to help protect your friends and family. We encourage anyone who gets a call from us to provide us as much relevant information as possible. We know getting a notification of a positive result can be scary or confusing, but by working with our contact tracing teams, you're helping us attempt to break the chain of transmission. And now I'll open it up for questions.
All right, the first question we have is from Alan with Inside of Knoxville. He says, just over a week ago, there was a sudden drop in the number of Knox County residents hospitalized. Then today, the number, jumped on me here. And today, the number dropped by 50% overnight to a lower level than we've seen in a week. Is this a record-keeping adjustment? And with all the recent cases, is it correct that we now only have 16 residents hospitalized?
It is correct that we only have 16 Knox County residents hospitalized at this time for COVID-19. That number could have changed between the time this was printed and me delivering this information to you. Great question for the hospitals about what they're seeing in cases and what's allowing folks to be discharged from the hospitals. But right now, we have 16 Knox County residents in the hospital.
From Megan with WBLT, is the health department aware of how well social distancing was able to be observed at Knox County polling places yesterday?
We were not. We did not do any checks on those. We know that Knox County Election Commission had a really well thought out plan. We consulted with them on that plan, and if they followed the plan, social distancing happened.
Our follow-up question was, is any information on how voting went yesterday helping to make a plan for voting in November?
Great question for the Election Commission. Not sure how things went for them.
From Brian Hornback, do you need applicants for contact tracing employment positions due to the state contracts?
So we're working with staffing agencies, and actually we could get that staffing agency information out there. That actually, thanks for that question, because that's been one of the things I've been meaning for us to get that information out there. So people who need a job or are interested could apply through those staffing agencies. So it's not directly to us, it's through a staffing agency.
His follow-up was, if you are, can you provide us, the media, with links to job employment applications? If you have enough candidates in the applicant pool and do not need us bringing it to the public's attention, let us know that too.
Sure, we'll be happy. I think the staffing agencies that we're working with are actually staffing for everybody across the state. So I think there's plenty of need.
From Paul with WBIR, good news in the numbers today. Hospitalizations down, recoveries again outpacing active cases. Have we turned a corner, or is it too early to say?
I think it's too early to say. And what I would say to that is, this is not the time to go, we did it, we're good. Please, please, please keep doing the 5 core actions. Staying 6 feet apart when you can, wearing a mask when you're in public, washing your hands, staying home when you're sick, and cleaning surfaces frequently. That is the only way we're going to keep our numbers moving in the direction that we're moving. I'm excited about the direction the numbers are going, but I don't think we can call this a trend yet. I think we all have to continue to be diligent. It's like when you're trying to lose weight, if you lose that, after you lose those first 5 pounds and you go, man, this is easy, and go back to your regular activity, those 5 pounds and probably a little bit more are going to come back.
Also from Paul with WBIR, what is a pulse oximeter? Should people have them at home in case someone gets COVID?
A pulse oximeter is something that tells you how much oxygen is in your blood. It's a medical device, really not recommended for home use, except in certain situations if a doctor were to prescribe one for somebody maybe who has a breathing problem, and then people are educated on how to use it.
From Jeff with WATE, can you tell us about your discussions, if any, with Knox County schools in the last few days, given their efforts to move back reopening schools by another week? Will that help flatten the curve?
Well, I mean, I think questions about why they changed the reopening date should be directed to the schools. And as we've said many times, we talk to the schools. Somebody in our office probably talks to somebody at schools every day right now. But as far as leadership talking together, we talked yesterday, just back and forth, Q&A, providing guidance and advice on how they can safely reopen, questions about athletics and things like that. So really just providing guidance that then they'll take back to Superintendent Thomas and the school board potentially, and decide on how they're going to implement any of those recommendations, or if they implement those recommendations.
From Vincent with the Sentinel, any update on the anonymized cluster information I requested?
We do have an update on that. We now have access to that state database where that information is being kept, and we have a plan for getting out to you on Monday. We too have been frustrated that we couldn't get access to the information, but we've finally gotten access. So we'll be talking more about that on Monday and have that information for you on Monday.
From Jeff with WATE, have you been in contact with bar owners about the curfew order? How is that change being received?
I have not been in contact with bar owners. However, my staff has been in contact with bar owners, and I'm looking at people in the room to see if they know anything, because I haven't heard anything from anybody. What I do know is we haven't had any complaints since Wednesday that I'm aware of. So perhaps it was received well.
From Paul with WBIR, you mentioned that testing lines may be cut off early this afternoon. How has the demand changed recently? Have you had to cut off the line, or is the demand such that there is no need?
That varies day to day, to be quite honest. Some days we have lines and people have to wait a while and we have to cut the lines off. Some days we don't. Sometimes it depends on our process. We have been collecting insurance information lately because we had some uncertainties about payment for testing and where that funding was going to come from. We have some reassurances about funding for testing, and we're going to be able to go back to not taking insurance information, which just makes the process go faster. When you go to your doctor, it's not a speedy process, and we're trying to move people through pretty quickly, and collecting that insurance information, slows us down.
From Jeff with WATE, when schools resume, what will the flu vaccination process be?
Great question. We are still talking with the schools and kind of scratching our heads about what that could look like. If you've ever been to one of our flu mist clinics, they were a mass clinic. They line up the kids in the hallway, and now we need to spread those kids out by 6 feet. That's a long hallway. We're usually in the gym, sometimes we're in the library in smaller schools. So we're not sure what the logistics of that looks like. Flu vaccine is really important amid COVID. We're going to still have COVID around. You don't want to get COVID and the flu. That would really be unfortunate. So flu vaccine this year is going to be really important, and we're going to try to figure out how to do it. We just might have to change our delivery model, and we're not sure what that looks like. We got to get through back to school first.
Any other questions? Please go ahead and submit them. From Paul with WBIR, how are you and your staff holding up?
We're doing all right. My staff we're doing okay. We're supporting each other. People are able to take some time off now that we have some staff coming in. So we're trying to rotate through people through who haven't been able to take time off to get some time with their family, and just get some time away. So thanks for asking. We're doing well. It's busy. but I think we're hanging in there.
All right, any other questions? Please go ahead and submit them now. All right, let's see, Vincent says 1 second. From Brian Hornback, he asked, was the public forum helpful? I believe referring to the Board of Health meeting.
I think the Board of Health had a positive response to the public forum. I think it went really well. I think it's always helpful to hear from the people we're serving, the people we're trying to protect. So if you heard, we're going to continue to do that on a monthly basis. The format might look different, but we're going to continue to do that. Oh yeah, and that we've talked about the fact that we've also gotten lots of emails from the public. All the Board of Health members have for and against the things that we're doing.
All right, any other questions? I know we're waiting. Vincent is typing, so we'll wait until we see that question. From Vincent with the Sentinel, COVID and flu have several symptoms in common, and COVID and flu comorbidity is a definite possibility. Has KCHD spoken to KCS about how to handle these cases?
So I think I understand the question. So how to handle cases of kids that have both the flu and COVID? They handle them the same way. Somebody who's actively ill at school needs to be sent home, whether they have the flu or COVID-19, it doesn't matter. A teacher, staff member, or kid, it's that whole stay at home if you're sick thing, that means don't go to school either. And we want you to do that no matter what you have. Even if you have a GI bug, we want you to stay home.
Any other questions? Please go ahead and submit them now.
Yeah, so being reminded that the 5 core actions work for flu as well as COVID-19. We all know that. Anybody who's been watching us for years know that I talk about washing your hands and staying home if you're sick and all of those things. So those things are going to be really important this year to reduce the mortality and the illness in our community.
Okay, great. Not seeing any other questions. So thank you all for your time. I hope you have a great, safe weekend, and we will see you again next week.